Hello, everyone. Welcome to our podcast series for International Women's Day, which is led by Transform Health. Transform Health is a global coalition of more than 200 organizations advocating for and supporting the enabling environment for the digital transformation of health systems to deliver universal health coverage. As digital transformation accelerates, it presents both opportunities and risks for gender equity in health. Millions of women continue to face significant barriers when seeking essential healthcare, treatment, and support. These gender inequities intersect with income, education, race, and other social determinants of health, leaving the most marginalized women underserved. Digital health offers a huge opportunity to accelerate UHC progress, including to address gender inequalities in health access and outcomes, and improve women's and girls' health and well-being. During Digital Health Week in November 2024, Transform Health launched a new policy brief titled Establishing Gender Equitable Foundations for Digital Health Transformation to Advance Universal Health Coverage. This policy brief makes the case for investment and action to establish the foundations and guardrails for a gender equitable digital health ecosystem, especially including recommendations to ensure that digital transformation of health advances progress towards universal health coverage to the benefit of all. Today, we're going to discuss with our partners and really see how they're taking actions aligned with the recommendations from the policy brief and the work that they do within this space of gender equity in digital health. Our session today is going to be about mainstreaming gender in digital health. And I'm your host, Danielle Mullings, who's the Impact and Partnerships Officer at Transform Health. So we're going to start off with Miriam, who is the Girl Center Lead on Evidence-Based Practice at Population Council. So Miriam, could you please tell us a bit about yourself, your role, and some of the work that Population Council is doing in this space?
Sure, great. Thanks so much, Danielle, and great to be here with all of you. Again, I'm MirianTemin. I work with Population Council's Girl Center, and the Population Council is a large, long-standing international NGO with presence in Washington, D.C. and New York, and then offices in 12 low and middle income countries, and we conduct social science, public health, and biomedical research to transform global thinking and action on critical health and development issues. And we put a major emphasis on the use of research results. So within the council, we have an innovation hub called the Girl Center, which uses evidence generation, convening, communication, partnerships, and we nurture talent to identify and promote the most effective ways to reduce risks and enhance opportunities for adolescents who are threatened by gender inequity. So when it comes to adolescent girls, we, over the past 2 decades, have really built the world's largest body of evidence on programs to improve the lives of adolescent girls in low and middle income countries. We're identifying best practices, refining critical elements of programs, and trying to use solid evidence to help organizations and governments allocate scarce resources to effective programs. So my role is to lead global efforts to promote evidence-based practice. As I like to describe it, I aim to narrow the gap between evidence generation and evidence use in policy and practice. And I'm excited to share information with you about a new initiative that we launched last year called Safe Empowered Technology for Adolescents. We, of course, identified digital technology as a research priority for the Girl Center based on recognition that the acceleration of digital access is exacerbating inequality between regions, between countries, between socioeconomic classes, and even within households, and that those dynamics are very heavily affected by gender norms, and why the gender digital divide is well accepted and pretty well understood as it relates to adults. We really don't know much about how this plays out for adolescents, especially adolescent girls.
Wow. So a lot of amazing work happening in Population Council. What would you say are some of those, major gaps that you have identified based on all of the evidence and research that you have been, engaging in?
So, in terms of evidence gaps, we're here to talk about digital health, and the Girl Center has found that the path to improved health really runs through a holistic, multi-sectoral approach. So, we are guided by a conceptual framework that takes a multi-sectoral approach to promoting health with digital technology, and we are conducting research to advance understanding based on this multi-sectoral holistic framework. And we're going beyond simply looking at issues of access, but also trying to understand use. For example, we have evidence on, in Bangladesh, a girl who is lucky enough to own a smartphone. How does she actually use that phone? So that's just one example of the kind of research we're doing. We're looking at policies. We're looking to generate more evidence about coverage of digital programming. And we are looking at how age, gender, and socioeconomic status influence these dynamics across the adolescent socioecology. So also importantly, families and peer networks, as well as communities. So you asked specifically about evidence gaps, and in all of those areas that I mentioned, there's really very, very little we know about the details of young people's attitudes and how gender influences those, and use and practices and skills, and how those all influence digital risks and opportunities.
Okay. And as you work towards filling these evidence gaps, based on the research and programming experience so far, what key lessons have you really derived for narrowing the gender digital divide for young people?
So, first of all, just very briefly, we're talking specifically about adolescence, and we have learned over the years that it is vital to be intentional about addressing young people in this very dynamic life stage, full of transitions internally as well as externally and socially. And we have found that if you're not intentional about addressing adolescence, you're likely to miss them, especially those who are most marginalized. So that is a very vital lesson we've learned from programming that's really relevant in the digital world, which brings me to a broader point that there are a lot of lessons we have learned about programming for adolescents, marginalized adolescents, related to coverage, and they're also relevant in the digital realm, but there's currently quite a divide between those who are working in digital technology and those who are working in the analog world. So a big lesson is that we need to be learning from programming spaces, and certainly those who want to hear more about that can contact me and follow up, given that time is short. But I will just emphasize this point about coverage, and really that it's so incredibly important in the digital realm, not just to look at who's using digital programming to promote health and other outcomes, but also who is not using these technologies, and is there a risk, in fact, of exacerbating these inequities if we're not reaching our targets?
Thank you so much, Miriam. I'll just end with one more question, and it's going to be around like how can we ensure that as experts, researchers, etc., in the space that are working towards narrowing the gender digital divide, how can we ensure that they are learning lessons from previous program experiences and making sure that it's very evidence-based, which is the core function of like everything that you do. So what kind of advice would you give to experts who are working within this space, and maybe some examples of work that you are doing with partners within the space as well?
Certainly. Well, I'll give an example that the Population Council co-hosted an action-oriented workshop with the Girl Effect, who we're going to hear from next, last year, to try to bring together actors to look at evidence gaps and to prioritize a research agenda collaboratively, and following on with that. So really talking to each other and trying to find platforms like Transform Health, for example, to improve coordination and collaboration. So there's some uniformity. Learning from the programming space in a coherent way is another key approach. And evaluate. There are surprisingly few impact evaluations of any sort of digital programming for technology, and this includes critically who is using and how that aligns with the intended target beneficiaries. And then, very importantly, talk to young people. And we're going to do that next, I know, but hearing from young people will help to ensure the relevance of programming, but also the delivery channels. So, for example, are young people more comfortable getting sexual and reproductive health information from a chatbot that a group has generated, or from YouTube or Instagram? So ensuring that we're relevant, that we're keeping up with the times, which are changing rapidly. You need to ensure meaningful participation and leadership by young people.
Thank you so much, Miriam. So we've heard a lot of key themes from you. And I think it really centers around needing to understand and communicate with our target population, which in this case would be young women and girls across the world. And so as we develop these different pieces of programming, it's important to ensure that it's relevant to that target population, and also important to ensure we're evaluating and incorporating the learnings from those evaluations as we continue with programming. So thank you so much, Miriam. Population Council is doing amazing work. And as you said, yes, we will now be hearing from a young person who is doing amazing things in the space. And so it's my pleasure to introduce Marlyne Atieno, who is a youth advisory panel member at Girl Effect. So Marlyne, maybe if you can tell us a little bit about yourself and what you do in this work on the youth advisory panel, and then we'll get into a few more questions around digital health.
Thank you so much. I hope I'm audible. Thank you. So my name is Marlyne Atieno. I'm a youth advisory panel member for Girl Effect. I also host a podcast, which is a product of Girl Effect digital solution in creating safe spaces for we young women to speak about our lived experiences in sexual and reproductive health. Aside from that, I am a digital youth advocate who champions for the rights of young women in reproductive health. So a bit about what I do, that only means that I'm a youth expert who gets to sit with a smaller group of young people to kind of inform the decisions that Girl Effect is doing in terms of trying to respond to some of the challenges that we are facing in regards to accessing information and also services in sexual and reproductive health, because there are so many challenges when it comes to that. And so us is just to inform them of those challenges and how best we would like for them to create solutions that suit those needs that we have. Yes.
Thank you so much, Marlyne. So it sounds like you have quite a bit of experience in, advising organizations and also speaking with different young women as you try to make sure that your recommendations are well, informed based on perspective. I would love to ask you, what does mainstreaming gender in digital health mean to you?
Thank you. So mainstreaming gender in digital health to me means just having a gender lens in everything that we do. So if it's coming up with programs, like how do they look at different genders and how do they look at the vulnerabilities that come with that? If it's creating digital tools, like what are the capabilities of the different genders, even when it comes to the different innovations and interventions that we have. It's just trying to create solutions that address gender disparities, whether it's digitally or even the challenges that the different genders face on a day-to-day. Yeah.
Amazing. So as we try to mainstream gender in digital health, can you give any examples of, gender responsive digital innovation that you've been a part of, or, positive case studies that you've seen around you?
Thank you so much. So I'd like to quote something that Miriam had said. The reason as to why we young people are missed most of the times, and I put that in quotes, is because we are not given the spaces to talk and to air our issues. And so our solutions are made out of assumptions and things that have worked in the past, which is not the case of today, because we have technology and we have so many things that interfere with how we make our decisions as young people. And I'll speak on decisions based on sexual and reproductive health. And so what Girl Effect did is they brought in a youth advisory panel, which I was part of, and we started designing from scratch. So the minimal viable product that we created is a WhatsApp chatbot, which is AI powered, and you are able to ask sexual and reproductive health information. This is just to capture the aspect of there's so much misinformation, and Google is one of the search engines and Google has everything. So how do we also mainstream that to ensure that it's authentic and it's direct to the point? So as part of the panel, we realized that one of the digital solutions that will work at this time is a WhatsApp chatbot, because almost everybody is able to access WhatsApp. And also one feature of the digital solution was having a USSD code, which is also to cater for girls in remote areas who don't have smartphones and use featured phones. So how this works is that the WhatsApp chatbot doesn't require you to give so much information about yourself. And a cool feature is that if you're not satisfied with the response that it's giving you, because it's AI powered, you're able to talk to a healthcare provider. And all this is free as long as you have access to data. The only time you have to pay is when you're accessing services now from a clinic that they're also partnering with. The cool factor about our chatbot is that it is multilingual. We have Swahili, we have English, and then we have a bit of Sheng, which is still on development. And as young people, we are still being engaged in that process of developing it to ensure that the product actually responds like on a high percentage to some of the challenges that we face. So I think one of the things that has worked greatly and has shown even the numbers, I can't mention the numbers because I don't have them, but I know it has performed so well in the country because of just how we young people have been involved. And maybe just to mention and not to forget, all the solutions that we thought that we had actually talked about, I think this was a year or 2 years back, are being put into place. So for example, we have a TV series because we still watch drama series. And so the TV series is just to give personas and to show real life experiences and real life challenges. So the TV series airs on our two of our most national televisions. And so this is accessible and it's targeting young women, but also parents can watch it. And so how is sexual and reproductive health information being delivered to us? How do we deal with some of the challenges that we have? So they're trying to create a solution that is all round and can holistically respond to the challenge of just having authentic information and also having youth-friendly services. Yeah.
Wow, there are so many important pieces that are coming out from what you've just said. I think the first one is about ensuring that we include young people from the start. So you've spoken about your role and the entire advisory panel's role in developing these new solutions like that chatbot. And then you've also spoken to basically making sure that the chatbot is very accessible, because you've spoken about things like accessibility around those who don't have an internet connection or just needed to get, are able to access it via SMS. And then you also spoke about it being accessible in a variety of languages and ensuring that it's local languages that are also prioritized in that regard. So I think this is amazing work being done by Girls Effect and very in line with the recommendations that we have within Transform Health's gender policy brief. So that being said, let's go into the next question. And I think I'm going to combine these last two. So if you could share with us, maybe if you have any other examples as well of how you as a young person, especially as a young woman, have contributed to shaping, different solutions in Girl Effect. I think the chatbot maybe is a primary one there. But then also letting us know if there are any upcoming innovations at Girl Effect that you're excited about, or where do you see this going in a few years?
Okay, great. So maybe just to add a bit of the features so that you get to understand why it is like the target audience is really like on board with it. The colors, like from the name YZ to the colors to the feel, the images that are put there, like we have to approve of everything. So it's like us being trusted with each and every information that goes into it. As well, we have a podcast, like I mentioned, Speciaco the podcast, which is in all podcast platforms, where we get to share about our life experiences. So it's me and other hosts just having these conversations. And sometimes on board, we have an expert. So let's say we are speaking about gynecology. So what is that? Why are young people not going to the clinic? So it's also trying to educate the audience to take up the space and have the courage to go to the facilities. So something that I'm really excited about what this product will look like when it is complete, because like I mentioned, this was a minimal viable product. And so it's like they're trying out to see, I'm not in the backend office, but I'm thinking they're trying out to see if this will really work for the larger audience. Because from what it has shown, we are just not the ones that give the information. So we have a youth advisory panel, which is about 5 people. And then we have a larger team of youth creators who also approve that. And then now Girl Effect goes into the community again to approve the same. So I think doing this, they're trying as much as possible to personalize it to like every young woman. As much as that sounds so difficult, they're trying to ensure that all features and all kind of women in their diversities are captured in this solution that they're creating. So I'm excited about that. I'm excited about the Tuki series, drama series that we are about to finish the seasons. I don't know what Girl Effect has in store for us, but I'm hoping they're shooting more series. I'm excited to see more young people being involved in these processes. So part of what Girl Effect has also done is that it has economically empowered us young people. So we have like my fellow young people who are monetizing and ensuring that the language that is being used, that every response is actually taken into account. And also the chatbot and all the platforms have a response mechanism kind of system. So where you are able to tell like anyone, so this is open to anyone who accesses the platform, they're able to review it and give their pros and cons about the platforms. So I'm excited about so many things that Girl Effect is doing, some that I know and some that I'm hoping they have in mind as well. Yes.
Amazing. So Marlyne, I'm going to ask you one last thing that just came to mind. I think for any young woman that may be watching this, and maybe those who may be having, challenges in their own countries or their own communities with trying to mainstream gender into the health programming, especially digital health programming, what advice, would you give to that young woman who may be feeling a bit dismayed or wondering where to go from here? What would you say?
Okay. I'm used to people who have made it being asked these questions, but seems like okay, this is what I will say. I think organizations and even like a few CBOs are trying to do a lot. And like yesterday I mentioned, I feel like I'm a very lucky young girl to be in this generation because it seems like I'm in everybody's mind and everybody's trying to help me out to reach my brighter future. So what I would like to say is we might not have WASI in your country, or Girl Effect might not be implementing their programs in their country, but then I'm sure there is someone who is working on something that can address the challenges that they're facing. So as young girls, even without those opportunities being created, we can always come forward. When I was at the Digital Health Forum 2025, I hope I'm getting that right. I got to meet a very young girl from Rwanda, and she has her own organization that is inspired by her own lived experience and her own journey to where she has come. And this inspired me so much because I think as young people, we are so comfortable in waiting for organizations to bring the solution, for organizations to step in and address the challenges that we are facing. But really, I feel like even if the opportunities are not there, donors are available and we can always learn to do, even if it's proposals, or we can always approach an organization that is doing amazing things in other countries and just let them know of the challenges that we are facing and if they are able to support what we are doing. And even if that is not the case, I believe that parents have the best at heart for us. As much as we are saying it's difficult to have sexual and reproductive health conversations with them, we can always start from somewhere and build that relationship where it's open for us to talk to them. So for me, it's just to call them and let them know that someone out here cares, and they can always have the courage and be brave to step into the space to be the change that they want to see for themselves and even for the younger girls.
Thank you so much, Marlyne. Okay, viewers, you've had a fantastic podcast where we've heard from both MirianTemin, who is the Girl Center lead on evidence-based practice at Population Council, as well as Marlyne Atieno, who's a youth advisory panel member at Girl Effect. A lot of the key themes coming across are more than in line with the gender policy brief that Transform Health has released, especially focusing on increasing gender expertise and integrating gender indicators into formal processes. Miriam spoke to some of that need for, that evidence-based engagement around the gender digital health divide. And we also have recommendations around rooting the design in human-centered approaches and participatory approaches, which Marlyne has spoken a lot to in terms of one positive case study of this happening with Girl Effect and the WASI chatbot that they've released. Overall, we're encouraging organizations across the world to increase the number of women in leadership and decision-making roles in digital health. And you can look at formats like the same youth advisory panel that Girl Effect has done. Investing in people, investing in digital infrastructure and technical support for health workers, and overall building the digital literacy of women, girls, and the health workers that serve them. So this has been a fantastic episode. Thank you all so much for listening. I've been your host, Danielle Mullings, and it is a pleasure to continue to work in this important field of work. Thank you so much, and have a good International Women's Day.